Scleroderma has a whole range of antibodies, and this list of antibodies, I'm afraid, is growing all the time. And when I qualified, we probably knew mostly about the first two, but now we know about far more. And I learned only a few days ago that anti-centromere antibody, which is one of the commonest antibodies that we see in scleroderma, actually occurs in two forms. So there's even two subgroups of anti-centromere antibodies these days. And again, the antibodies can help you by giving you an idea of what to look for clinically. So they tend to associate with particular patterns of disease. So anti-centromere antibodies, for instance, are specifically associated with limited disease, limited scleroderma. Now, that's not to say they're unique to that. In fact, I've got a couple of Sjögren's patients who carry the anti-centromere antibody, and equally we see people with diffuse scleroderma that carry it, but that's the strongest association. And many of you may have in the past been diagnosed as what doctors used to call CREST. And CREST is a descriptive term which describes patients who have a classical accumulation of features, including calcinosis for the C, Raynaud's for the R, esophageal dysmotility, I'm afraid it's the American spelling without the O for the E, sclerodactyly, which is the sticking down, the sort of tethering of the skin that you see in the fingers, and telangiectasia, which are the little blood spots you see under the skin. And it's also associated with something called pulmonary artery hypertension, which I'll mention later, which is a condition that affects the heart and the lungs. Worth noting that this antibody may appear in your bloodstream many years before you develop the skin changes. So it is a marker of, but it doesn't mean you actually have clinical disease at that point in time. But certainly if we see patients who are strongly positive for this antibody, we would keep them under review and look out for problems in the future. The next one you may have heard of is the anti-SCL70, which tends to be associated with what we call diffuse disease and can be associated with ILD, which stands for inflammatory lung disease. And there are a whole range of others that we can see in patients with scleroderma and patients with overlap conditions. This bottom group here are much more likely to be associated with the overlaps: anti-PMSCL, most often with myositis, muscle inflammation, and anti-Ro more often with Sjögren's, and new ones being added to this list all the time. And antibodies are important, but they're not the be-all and end-all of things. They help doctors decide which group you fall into. They may help guide the diagnosis and guide investigations, but they are not a diagnosis in their own right. So you do need clinical features to go along with these. And this is to show you yet more antibodies. And this is a beautiful, from a medical point of view, this is a beautiful little picture, which shows you all the different antibodies and gives you an idea of what they're associated with. And you can see that there's a whole list of antibodies here that are in the connective tissue disease overlap group. So these are patients who tend to have overlaps. The Ro one we've already mentioned is the one I commonly see in Sjögren's, and PMSCL is one commonly seen in scleroderma and in myositis, muscle inflammation.